Urinalysis is used to test 10 aspects of the urine. It tests specific gravity for hydration, pH tests kidney function. It checks protein and blood levels in the urine to test for a wide variety of conditions. It looks for leukocytes and nitrates to detect infection, tests ketones and glucose levels to monitor for diabetes, and tests for bilirubin and urobilinogen for liver function. In order to perform a urinalysis, you must first have your patient urinate in a specimen cup. Then you must apply the proper PPE for the situation. You must visually observe the color of the urine first to assess hydration, and then dip the urinalysis strip into the specimen cup. Wait 1 to 2 minutes and read the results based on the chart you find on the urinalysis strip container. Once you read the results, refer the patient or to any other healthcare professionals if necessary based on the abnormal readings, and then dispose of the urine and the used strip in a biohazard labeled container. Hydration is tested visually based on the color of the urine. The more pale the urine, the more water it contains. Therefore, the darker the urine, the more dehydrated a person is.
So today this video is going to be showing you how to do the process of a urinalysis. So when you're going to want to start with your PPE, either your gloves or if you want to wear a splash guard, if you're afraid of it splashing in your face. So you want to open up your little specimen cup and then take your strip and just dump it in. Make sure all of the pads have been saturated, and then we'll tap off the excess, and then you'll put it aside for a couple of minutes. It's already been read or already been sitting, and the colors have started changing. You're going to take the bottle that the strips have come in, and you're going to compare each strip, each line, and they're all coated all the way down to chest. So it looks like, so these ones are the normal readings, and then as far over you get the abnormal ones. So you just compare the different colors to the different shades on the bottle, and then based off of the different readings you get, you can refer your patient to whoever it needs to be, whether depending on which test comes back, abnormal or negative or positive. So then you just keep going all the way down, checking to see, make sure it's not in an abnormal fashion, and then you're all done.
So today I'm going to show you how to do skin fold testing for BMI with the baseline skin fold caliper. Whenever you do skin fold testing, your athlete, patient, student, whatever, needs to be dressed appropriately so you can get to the right spots. So for a girl, it's going to be sports bra, shorts, spandex, whatever. Guys, shorts and no shirt. So we're going to get started, and the first place that we're going to test is her tricep. So you're going to go halfway between the acromion and the olecranon, and I already have it marked. So you can mark it so that the second time through you're making sure you're testing the same spot. So I'm going to pinch right above it and make sure that I'm not getting any of the muscle. And I'm going to pinch, and then I would record what the measurement was. So the next place that I'm going to go to is her subscap, so I'll have Haley turn. This part, sometimes the sports bra might be in the way. Hers is fine, but if it is, just ask them if it's okay if you move it. So I'm going to go 1 inch from the medial border of the scapula, and I'll mark it. So you'll pinch right above your mark, read it, and record it. The next place that I'm going to go is her chest, and that's going to be halfway between your axillary area and your nipple. So I'm going to have Haley put her hand on her hip, mark it again. We're going to go about right here. So I'll take my caliper, I'll pinch here, and then I would record the number. After this, the next place I'm going to go is her mid-axillary region. So I'm going to have her cross her arm to her opposite shoulder, or she could put it behind her back again like we just did. So now her sports bra is in the way, so is it okay if I move your sports bra? We're going to lift it up a little bit, and we'll put a mark. Then I'm just going to pinch, and then I would record it. The next place I'm going to go is her suprailiac region, which is right above her hip bones. So I'm going to have her put her hands on her hips, and then I already have one marked. So I'm going to pinch right above it, record it. The next place I'm going to go is her abdomen. So I'm going to go right above her belly button. And I'll pinch, read, and record. The last place I'm going to go to is her thigh. We want to do all the measurements on the same side. So I'll do her right thigh, and I'm going to have her lean her weight onto her left one and kind of cock this knee up. I already have a mark, so I'm going to go right above it. And you have to pinch and make sure there's no muscle. Squeeze and record what it says. You're going to do it 2 times, and then you're going to average for her BMI.
For baseline skinfold measurements, men and women are measured at the same 7 sites: the triceps, the chest, the mid-axillary region, subscapular, suprailiac, abdominal, and thigh regions.
So now I'm going to show you how to calculate BMI using the Skindex Skinfold Caliper. This one is digital, so you have to set the caliper in accordance with the age and gender. So Haley is between the age of 18 and 26, and she is a female. So we're going to set it to 6 because that's the correlating number. And then we will turn the power on. And then the 3 areas that we're going to test with this are the triceps, the suprailiac, and the thigh. So I'm going to go ahead and do her tricep just like in the other video. And I'll grab, pinch, click this, and hold it for 2 seconds, and then I'll let it go. And then the next one, I'm going to do, so I'll grab this, pinch, hit it, and let go, and then I'll do her thigh. I'll squeeze, pinch, and let go.
When using the Skindex caliper, men and women are measured at 3 different sites. Men are measured in the chest, abdomen, and thigh regions, while women are measured in the triceps, suprailiac, and thigh regions. Calculating BMI percentage is similar for both the baseline and Skindex calipers. For the baseline, you take the average of the 2 measurements at each site and then add all 7 numbers together. You then look at the chart on the manual to get the BMI percent based on the millimeters of skin and their age. For the Skindex, you just add your 3 measurements and locate the percentage on the chart in the manual based on age and millimeters of skin. For example, if your measurements equaled 276 on a 19-year-old male, the BMI percentage will be 23.1.